hope that this phone does not overheat because I'm sitting in the car. I needed to get it out of the house. Babe just went to her practicum and I need to go to Dollar Tree to get some stuff because I'm trying to decorate our apartment for Halloween, and there is a truck behind me that just parked there and I have no way to get out. So this is really Babe's car and she has to be at practicum at 12. So I told her to take my car because I parked like further down in our apartment complex. And so that's where she's going. I just went to the leasing office and gave them some Coke Zeros because Babe and I tried to drink them, and they were pretty nasty to me and to her. So I just went ahead and gave it to them and they took it. So yeah, sorry if you can hear the air conditioning, but it's hot in here. So yeah, I wanted to go to Dollar Tree and get stuff, but because there's a truck behind me, I was like, well, I'm gonna just go ahead and talk to the camera now so that I can post this on YouTube. I am trying to get back into YouTube. I am trying to find something that makes me happy outside of nursing, because right now me and nursing are not getting along. And I just wanted to come on here briefly and just explain a little bit of that. I had a really rough time in undergrad as far as nursing. Like, I found myself really contemplating whether or not nursing was the career that I wanted to choose. Going through all of that, going through depression after depression after depression, literally to the point where I was losing weight. I wasn't eating as much. And I was going on diets, causing me to lose even more weight. It was just a lot. And that was all in undergrad, really in my last year of nursing school. And then now for me to be an actual nurse, I have 2 weeks left of orientation and then I'll be on my own. And I just feel completely overwhelmed. Of course, you know, you'll have the resources, like you can ask your fellow nursing co-workers, you can ask, you know, the house supervisor, you can ask your charge nurse, whoever. You can ask people about certain things if you have questions, you know. But I expected nursing to feel a little bit differently. I'm not bashing the actual job, it's just really you have to have like have tough skin, and honestly that's something that I've been trying to develop over time. I don't know, it's just been something that I've been trying to develop over time, and it can be really stressful because you have to do things that you normally wouldn't be comfortable doing, and then there's no in between. Like, there's no, okay, here's what you're not comfortable doing, here's what you can do to help you get there. It's just you're jumping literally from here's what you're not comfortable doing to doing something you're not comfortable with. And for instance, the unit that I work on, it is a post-op unit for like cardiac procedures. So the patients that I get are usually older, like maybe 50s and up. Occasionally we'll have like some young patients that are like in their 30s or so, but majority of them are older, like the older population. So some of them can be really mean, and I understand that you're going to you know, deal with patients who are just mean. Some of them just feel sick, they just feel really bad, and unfortunately they, you know, act in a way that's just not the best. Like, they're just rude, they're just mean, and they say anything, they treat you however. But to have that along with having 6 patients, along with having 2 that may be bleeding, 1 that may be really needy, 1 that just got to the floor, and 1 that's about to leave, like, that can be a lot. And I just feel like my experience so far hasn't been the best, just because I'm on my 3rd preceptor, and my orientation is only 10 weeks long. I'm on my 3rd preceptor, and I have 2 weeks left. Sorry, I'm missing a nail. Like, they popped off. One of them popped off. But I'm on my 3rd preceptor. I have 2 weeks left, and next week I'm getting a new preceptor because the preceptor that I have now is leaving. So I'm just like, this is a lot, and I feel like I'm having to learn so many different things, you know, because it is very different than nursing school. Like, it's like everything that I learned in nursing school kind of went out the window. Like, the basis of it, yes, I still kind of understand certain things, like, you know, basic information about how to care for a patient after a cardiac catheterization, but at the same time, like, there's different protocols and different orders that different doctors may want. And so just like trying to balance all of that with learning from 3 different people, that's hard because I'm learning 3 different ways on how to deal with certain situations in such a short amount of time. So I'm coming on here just to, you know, use this platform as my diary in a sense for nursing, because right now I'm not finding like my niche. I'm not finding something that I'm just extremely happy about. But what I've decided to do is just invest a lot more in myself and my happiness. And that means me actually getting out of the house more, doing things by myself, just doing YouTube, doing makeup, investing in like my makeup collection, investing in doing my hair, and just doing things that excite me, like decorating the house when babe is going to practicum and I have nothing to do for 6 hours. You know, I'm gonna do stuff like that. I'm going to shop, I'm going to decorate, I'm going to clean the apartment, I'm going to cook, bake, things like that, because those are the things that bring me joy. But I feel like I haven't found a lot of videos that talk about actually getting through the process of being in your orientation phase of nursing, or just dealing with mental health, like you're dealing with having a positive mental mindset while going through tough phases in your nursing orientation, or in nursing school for that matter. And so I just wanted to come on here and talk a little bit about that, because what I'm currently experiencing is dealing with a orientation that is all over the place in a sense, and it's causing me anxiety, and it's causing me to rethink something that I thought that I wanted to do. It's a lot, honestly, and I've had to pray about it. I've cried, I've had literal breakdowns, I've just been really feeling out of my character and feeling like, dang, I went through 5 years of undergrad because I failed a semester and I waited a semester for my program to open. And I went from there, like being depressed and feeling just like really anxious and feeling out like I wasn't good enough, to literally actually making it, being in the actual career or the job that I thought that I wanted, and still feeling inadequate, still feeling uneasy. And I understand, and I know that I'm gonna get through it. I know that it's gonna be an experience, but I didn't know that it was gonna feel this way. Like, I didn't know that. I knew, yes, it was gonna be hard. I knew it was gonna be a struggle. I knew that it was gonna, you know, I was gonna have to still work for it, but I didn't know that like I was gonna have to physically work for it as well as mentally work for it. Like, mentally meaning being sad, having days where I just feel really completely beat up and down, and feeling inadequate, feeling like I wanted to cry every single day, feeling anxious going into work every single day. I didn't know that I was gonna have all of that. I didn't know that that was gonna be something that I was gonna struggle with. So I have made it my choice to invest more in YouTube, invest more in makeup, you know, the beauty side of things that I like to do, invest more in just being a really great future housewife. And just really just trying to find myself more and do things more that I like to do, because on my days off I really need to get out more, do more things versus just sitting in the house and moping, crying, and being depressed. As soon as this truck gets from behind me, I feel like I'll be able to start my day and actually try to do something and feel productive before going back in the house and like editing this video and figuring out more content to record. That's pretty much it. I just wanted to come on here really briefly and do like a little mini car rant about, you know, being a new nurse and having anxiety. If anyone has any questions, please feel free to comment them down below. And if you have any suggestions as well about like getting through the orientation phase of being a new grad nurse, as well as being a great nurse in general, I am open to the suggestions. And yeah, today is gonna be a great day, so go out there, live your life, and have a wonderful and blessed day. I will talk to you guys later.